With the loss of Visalia OB/GYN and other local health system services, what steps is the hospital taking to address community needs? Are you planning to increase bed capacity?
Yes, it's not a lack of bed capacity in labor and delivery or mother-baby. It really is a lack of obstetricians. So that was a major blow to learn about Visalia OB/GYN closing its OB practice, because for the most part, pretty much the entire commercially insured obstetrical market went to those physicians for their prenatal care and their deliveries. So the majority of the Medi-Cal population, and 62% of Tulare County's residents are under the Medi-Cal program, the highest of any county in the state. For the most part, those moms and their babies are cared for by the federally qualified health centers or Kaweah through our rural health clinics, Dr. Sabagal, Dr. Renhel. So it's not a bed capacity issue. Our most immediate is we need physicians. And so keeping Holly Quinn in our community and not letting her go to Reedley was a big win for us in the community. So she's already accepting patients and will expand her practice when she moves over to Visalia in November. Contracting with a national laborist group, which will bring more obstetricians to our community and have them physically in the hospital, that can free up the obstetricians who are not having to go back and forth from their offices to the hospital to deliver the babies. If they're willing to entrust the delivery to a highly qualified laborist, many hospitals across the country have these. Initially, when they go into hospitals, there's a little bit of resistance, maybe a lot of resistance, to allow somebody to deliver your patient's baby. But after a while, when they don't have to get up at 2 or 3 in the morning anymore, and they place trust and confidence in that on-site obstetrician, that will create more capacity in the physicians' offices to see more pregnant women for their prenatal care, as well as women wanting to get pregnant. So it's multifaceted. This isn't a role that the hospital has normally played in the past. Generally the physician community is self-perpetuating. We help. In fact, we were helping Dr. Wiseman and Visalia OB/GYN. We were helping them recruit for the last year and a half, willing to provide sign-on bonuses and income guarantees to be able to support their ability to recruit new obstetricians into their practice, but they just weren't successful. So we're really going to have to pull out all the stops and
pursue all these different avenues to really address the problem.
I have Carrie Noeski, our Chief Nursing Officer, to help answer that question too.
So, like Gary said, Visalia OB/GYN, their providers have gone down. There's a piece of that, and then the surrounding areas, the volume coming into our facility. Yes, we are aware of that, and we are working. We can't make more beds. We don't have. We're landlocked. We have opportunities though with working with the obstetricians to help with the length of stay for the patients as they're laboring through and move them into delivering the baby. But we also have the opportunity with increasing our nursing staffing, which we're working on. So a labor delivery nurse years ago would have 3 to 5 years of experience before they ever had a shot at labor delivery. Now, with the shortage that Gary talked about earlier, we have labor delivery nurses that are coming in, but they are fairly new nurses. So their orientation takes 5 to 6 months. So we bring in the nurses, we take 6 months, rightfully so, it's a very high risk area to train them and bring them on. We just found out this summer about those changes. There was really quick turnaround on the changes in Tulare and Hanford with their programs. Didn't have 6-8 months to do the ramp up. We have brought in travel staffing to help with those areas and fill the vacancies, We are trying to bring in some more travel staffing to help with that. But it is a team. It is the nursing staff being able to keep the beds open and staff the beds, take the patients in for the C-sections, and it's working with the providers, which our providers are very strained right now. We have, sometimes a provider will deliver 12 to 15 babies in one day. That's a lot of work for a provider to do all of that. So the OB hospitalist program is another piece of that bigger picture to make all those services work well together.